Hi everyone, welcome back to our channels. My name is Jade and this is
Dr. Rhona.
And today we are going to be teaching you how to become a dentist. Going through the whole application process and a bit through dental school and beyond.
100%. Things have changed. I'm really old and Jade is really young, but let's see what I can do, because the process was completely different when I was at university and getting into university and so forth. But I will share some older words of wisdom, you know?
So first things first is you need to get your GCSEs in order to choose the right A-level subjects. So usually you need to have 3 A-levels. One needs to be biology, one needs to be another science, and another can be whatever you want. So I, for instance, did biology, chemistry, maths, and English literature.
You did English lit? I'm going to tell you what I did too. Okay, so
right.
it was the same when I was at school. So you have to do 2 sciences and then 2 whatever you want for AS levels. So I did biology, chemistry, English lit, and philosophy.
Oh wow!
Yeah, diversion. Yeah. Yeah, I was actually really into it, and I almost went to Oxford to do PPE, which is philosophy, politics, and English. And then my dad was like, "Get a real job. What are you going to do? Become a teacher?" I was like, "Dad, a teacher is a really good job." So we can just see that, you know, that's the Middle Eastern thing coming out that led me to doing dentistry. But yes, it was the same at uni. But also, we had to show off that you had manual dexterity.
We didn't really have to.
We had to for the university application, for the interview.
Yeah.
And I was so bad at art. I literally was so bad. I didn't even do GCSE art. So what I did was I went to a jewelry making class every Thursday evening and went to learn to make jewelry and then took it to my interview. Random.
That's so cool. So after you've done your, you've chosen your A-levels, you then have to go through an admissions test, which I don't think Rhona did.
No.
But we have the UK CAT, or the UCAT now, or the BMAT.
Yeah.
And I think only Leeds is the only school that does BMAT. But those are...
That's where I went.
Oh!
Leeds.
That's so cool.
Yeah.
The only reason why I didn't apply there is because they did BMAT.
Don't know what BMAT is, but we didn't have that back in the day. It was show your manual dexterity, go to jewelry school, amongst other things. Yeah.
Okay. So you do your UK CAT and your BMAT, you get your grades, and then you apply to dental school with that. Then is the interview process.
Cool.
So I had panel interviews or MMIs. Did you have?
So we had interviews. So we had the interviews, and with the interviews, I said you have to show manual dexterity. You've also got to show that you've done work experience. So you have to have gone to a dental practice and done work experience as part of that. And quite a lot of knowledge about the NHS as well, how the system rolls, what you're expected to do and what's involved in it.
Yeah, so that's quite similar actually. We have 2 weeks minimum requirement for you to do work experience, and then we have MMIs, so that's like maybe 12 stations of 5-minute quick interviews with different people.
Okay.
And then you have a panel. So my university was panel, Barts, which I actually enjoyed a lot more.
Cool.
So it was like a group of dental professionals that you just speak to, and yeah, that's how you get in. Once you're in, you go through dental school, and each dental school has different types of examinations. Usually we have finals at the end of the year, but once you reach your 5th year, you do something called the SJT, Situational Judgment Test. And that's also followed by an interview.
So we just had the interview, and I think some top tips for interview, because regardless of what system is around there, is definitely showing that you have the skills to connect with human beings and that you can really demonstrate patient care. So I think compassion is such an important thing. For me, I made sure that I was doing a lot of things for charity, for example. So I used to work on Oxfam on the weekend. I wanted to show that I could give back and that I could hold a job as well. They want to really check that you can deal with stress, and they might ask you that question as well. So you've got to really think about how you would deal with stress, and you can't say like, I don't get stressed. You'd be like, okay, I get stressed and this is how I deal with it. And I think you've got to show that you've got a rational thought process. So for example, you say that, you know, that you understand there are challenges, that you're willing to work through them, that you find support, that you're, you know, you can think quickly as well on your feet, because dentistry is very demanding in that way. Some basics for like interview styles as well is have a fairly firm handshake when you meet someone, maintain eye contact throughout the interview process as well. Try and speak with confidence, because if people feel that you're really insecure, that also shows off in the interview. Show that you have interests outside of dentistry. So don't just say like, my life is dentistry and teeth, talk about extracurricular things. Jade does dance, as you know. I talked about my jewelry making class, aside from that. Also, things like socializing, reading, art and theatre, things like that. I was in watching art, not doing art.
It's just demonstrating that you're a well-rounded individual.
Yeah.
And I guess it adds to personability or likability.
Totally.
So after you've done the SJT, you've smashed it and you have pretty much graduated and you're a doctor. So then you go into your foundation year of training into a practice. So I'm not there yet because I'm in my 4th year of dental school. But do you remember what that was like for you?
So going into practice after VT?
Yeah.
Oh, God, probably some of the worst years of my life. I talk a lot about how difficult getting into dental school was for me. Number one, because I had Bristol as my first choice. The interview was really strange because I went looking like this, big hair, don't care, all the fashion attitude. And I don't think they really liked that. And then for the second interview, which was for Leeds, my mum told me to go completely plain and basically not really who I was. So I really wore a plain suit. I didn't wear any makeup. I, scraped my hair back, and I hate to say that that's how I got my offer, because I kind of pretended to be a bit of a science geek, which wasn't really me. Went into dental school, found dental school really difficult because I didn't get on with any of the dentists either. Same thing happened for vocational training. So when I was doing it with the vocational training, you applied to a region. So you had like London, and then you had like Kent, Surrey, and that kind of region. Then you had like the northern practices. And when you applied to them, you go for an interview and you get an offer based on the interview, basically. And I went to hundreds and thousands of interviews. I applied like everywhere that was near London, and I just got rejected. And everyone in my uni was getting like their first choice, their second choice. And I was so depressed because I was like, no one wants me. I'm so awful. And then I basically almost got into a practice during clearing, but it was a practice that I got into through the interview process in Kent. And it was a very normal dental practice in the village in the middle of nowhere. It was literally like, if you've ever watched Beauty and the Beast, Disney's Beauty and the Beast, like when Belle goes through the little town, such a quiet village. Anyways, that was me. I was basically Belle, and I wasn't doing the dentistry that I was doing now, but I think that VT for me was a means to an end, because people get really depressed about VT. They're like, how is VT? I'm not doing the dentistry I want to do. What's it like? And I always say, like, it doesn't define you. These things that happen early on in life that you get worried about just don't define who you are. I saw this really cool picture the other day that said things that worry you now, and it was like this massive ball, and then it goes how you'll feel in a few months, and then the ball gets much smaller, and then it goes how you'll feel in a few years, and then it just diminishes because it doesn't really matter. But for me, VT was about being in a practice that supported me, a practice that ensured that I could do safe dentistry too.
So once you've done your VT training, that is it. You are fully qualified as a dentist and you can become an associate in a practice.
Yeah, 100%. And again, apply to jobs that you want to be in, but don't just expect people to give you jobs. Sometimes I get people sliding into my DMs being like, hey, I want a job at your practice. I'm like, cool story, but show me something. So, I built up a portfolio, and I started CV dropping all over London with my portfolio and a very special cover letter for the practices that I applied that made me stand out in the crowd, and that got me my job in High Street Kensington, which was a mixed NHS private practice that allowed me to do the dentistry that I wanted to do, then led me to meeting my boss, who then led me to Chelsea Dental Clinic, who then led me to buying Chelsea Dental Clinic. So don't have self-limiting beliefs. So just have that focus and that clarity, and really a dental practice is about one that is going to support you with the bread and butter dentistry, not those massive smile designs, but the ones that really teach you how to do fillings properly, endos properly, and all those little things, and then you can go on to do the bigger stuff later on.
Amazing. So thank you guys so much for watching this. We hope this has been informative for you, great for you. And I just wanted to leave you by saying this. When it comes to getting into dental school, it's such a whirlwind, it's such an experience.
Emotional.
It can be very emotional, so please don't get disheartened if there are slight hiccups throughout the way. There are so many different pathways into dentistry. You can be a postgrad if you want, you can be an undergrad, it doesn't matter. But
where there's a will, there's a way.
Where there's a will, there's a way. So thank you so much for watching. We hope you enjoyed this.
See you next time. Bye.